Hi, we're the Midwifery team at Women's Care. My name is Tanya Gravel.
I'm Cinnamon Dawson.
My name is Jana Stoltz.
And I'm Kelly Hazel.
What question do you think we get asked the most is?
What is a midwife?
So let's tell them, what is a midwife?
Well, at Women's Care, all of our midwives are also nurse practitioners and board certified in midwifery.
So after completing a nursing degree, midwives additionally go back to graduate school or do a program all the way through. So start with nursing, graduate program, and then quite extensive hands-on training.
So how are we different than a doula?
Well, that's a really good question. We actually get that quite often. So doulas are non-medical providers that provide labor support and also postpartum support too for people who are having babies. Midwives, we do have a little bit of overlap with a doula where we provide labor support, but we're medical providers. So we care for people even beyond pregnancy. So pregnancy, birth, after they have their baby, we can prescribe medications, we can order lab tests, we can order diagnostic testing.
But I thought midwives only delivered at home.
So there are some midwives that deliver at home. There's all different levels of midwifery. Certified midwives, certified professional midwives, and certified nurse midwives. In our practice, we do practice hospital-based midwifery care.
Tell me what led you to the midwifery path.
For me, I had been a labor and delivery nurse for almost a decade, and I really wanted to start connecting with my patients before they came to the hospital. I wanted to be a partner with them throughout their whole pregnancy journey. And then when I thought about it more, I wanted to be involved with women's healthcare throughout the whole spectrum of their life. So midwifery really was a calling to me.
I learned about the midwifery model of care when I was getting my master's degree in public health, and that's when I decided that I wanted to have midwifery care when I was having my children. What really resonated with me was how midwifery care can really improve outcomes for moms and their babies, and that the care is really personalized, so that was important to me. After I had my children with midwives, that's when I really fell in love with the model and knew myself that I wanted to go back to school to be a midwife.
So I became a midwife because I've always had a passion for women's health and labor and delivery in particular. While I was in school researching nursing, I always thought I would be a labor and delivery nurse, but during my courses through nursing school, I realized I wanted to be a midwife. And another reason that led me to midwifery was experiencing and witnessing the birth of my youngest brother when I was 10. The provider actually let me assist during the delivery and afterwards showed me the placenta and told me more about the birthing process, and that's kind of really where my love began.
I knew at a very young age, probably around middle school, that I wanted to do something in healthcare. I actually got pregnant in high school and graduated high school with a 1-year-old. So I went on to become a registered nurse. I worked the opposite of Cinnamon. The majority of my RN career was in the clinic setting, and after working around other midwives, I decided I also wanted to follow patients kind of throughout their lifespan and be able to follow them into the hospital setting as well. So after 13 years of being a nurse is when I went back to school to get my master's in nursing. What do you think sets us apart from other midwifery practices?
I think that we have a really unique model here at Women's Care in that it's truly collaborative. We have a team-based approach, so really every person that comes into care at our practice gets to benefit from midwifery care. Even our really high-risk pregnant people can continue to see a midwife if that's what they would like to do for their pregnancy care. And we have physicians that collaborate with us in their care to ensure that they're having a healthy pregnancy. We also partner with maternal fetal medicine specialists and along with our physician colleagues to care for our high-risk patients.
Not only do we see the pregnant population, but we also see adolescents for their first time coming to the gynecologist. We see women for their well women's exams. We do fertility. So we really get to practice to our max capacity.
And I like that we also offer in-house ultrasound. So when patients are coming in for a new pregnancy, I know a lot of times they're anxious, wanting to know how far along they are, or if they're having any complications early on, we can always get them added to an ultrasound same day to confirm the pregnancy.
What I love about our group is how we practice as a team and how we are all like-minded, and that we encourage our patients to see all of us, because we never know which midwife they're going to get when they go and have their baby at the hospital, for example. And so that's one of the things that I love most about our group, is how we are like-minded, practice similarly, and share our patients amongst each other.
Why do you think our patients choose midwifery care?
I think there's so many different reasons why someone wants to have a midwife for their care. And a lot of people identify with just the ability to make a connection with their care provider and participate in the decision-making process. I think midwives do a nice job of sitting with their patients, really listening, and then providing education so that the patient and their family can make an informed decision about their care.
I feel like it's the same when it comes to labor and delivery, that we're there to support them through the whole process, allow them to make decisions for themselves as well, we provide great labor support.
And there's lots of different options that we offer at the hospital as far as labor support, and then just ability to birth and move in different positions. Our hospitals offer birth tubs so people can labor in the tub, and our hospital also offers nitrous oxide for pain relief.
Some people think if you have a midwife, that means you have to have an unmedicated delivery, which is not true. We support our patients who are wanting epidurals as well.
I even have a lot of patients that are going to have a planned C-section that come to see us, and they know that they are going to have a physician deliver them, but they want that midwifery experience during their pregnancy because of the education and the personal touch, the longer appointments. I think they really appreciate that more individualized care.
And we're also there for patients during their C-sections as well. If it is a planned C-section, we can assist the physician during the C-section.
I think a lot of people don't realize that C-sections take 2 providers, and it requires the surgeon, which is one of our collaborating physicians, and us right there as an assistant. So we don't say bye, see you later. We continue with you through that whole process and see you postpartum.
I like that people like to see a midwife also outside of pregnancy. So often we can help people get pregnant. We follow people after they have their baby for their annual visits, for birth control consults, all for those same reasons. It's nice to have that same provider be able to support you after a delivery, and you get to continue that relationship, possibly see them through another pregnancy, all for the reasons you guys have talked about, the shared decision making, walking with them, beside them, as they go through these different phases of their lives. What if I'm a high-risk patient, but I still want to have my baby with a midwife? Is that not an option anymore?
It is still an option to have a birth with a midwife if you are high risk. We do have the support of our physicians, so we co-manage care in situations where the patients are high risk.
I think that's something that really sets women's care apart, is the fact that everyone can have midwifery care here. Our high-risk patients, our low-risk patients all have access to the same level of outstanding care.
I don't know about you guys, but another question I get asked a lot is, so if I go with a midwife, does that mean I have to have a natural birth? And the answer is no. You're able to have an epidural, there's nitrous oxide, we're able to give IV pain medication in the hospital. We're gonna support them in whatever route they choose for their pain management, if they want pain management.
In addition to pain management that's pharmacological, we do offer a lot of pain management strategies that are based on us providing labor support, using the tub, moving, changing positions, and also supporting doula care in the hospital.
What do you guys love about being a midwife?
I think one of my favorite things is being able to share knowledge with the patients that I'm meeting with, and to really listen to them so that I can best guide them in their care. I really enjoy getting to meet my patients and finding out what's important to them. so we can work together on their plan of care.
I love so many aspects of midwifery. I love how no 2 days are going to be the same, just like no 2 deliveries will be the same. But a population that is near and dear to my heart is adolescents, because I was an adolescent pregnancy, so I love taking care of teens, whether it's for birth control, because of a pregnancy. I just like to help them learn about their bodies, about what to expect, and to know that I'm here to support them without judgment. I've been in their shoes, and it's a population I've always wanted to give back to.
In my own life, I struggled with infertility. So one of my favorite things about being a midwife is getting to partner with those infertility patients, getting them started on treatment, workups, discovering what's going on. Some that I can handle in-house, some I have to refer on. I also love that every day, as much as my patients hopefully are learning from me and growing, I learn and grow from my patients. I take so much value in every experience I have.
That's really true, is that we continue to learn and grow in our own practice by learning from our patients. We learn so much from them, just sitting and listening and working together to help them to improve their health.
And I really love the relationships that we develop with our patients and how we're with them through so many different stages of their life, and that they invite us into that space, that such intimate space.
Yeah, some of these days are days they're going to remember for the rest of their lives. The good, the bad, the ugly, all of them. And we get to walk with them through that space.